I want to ask you about anti-aging. I mean, do you have an anti-aging protocol to longevity, to health? Like, is there a supplement stack that you look at? I'm just curious on what your position on that is.
Yeah, so one of the things that I discovered, fairly early on looking at all this stuff was that body composition is really important for aging. So when you look at the changes that um, that someone has when they get old, when as they age, a lot of this resembles the same changes that you see in obesity and diabetes. So they're not necessarily of the same magnitude. If in other words, if somebody stays lean and fit, they're going to have fewer of these changes. But these changes do seem to be intrinsic to aging.
Hmm.
People lose muscle. That is a big one. That is very underrated. So if you don't consciously try to keep muscle, then you're going to lose it. And this starts from a very fairly young age, say the age of 30.
There's
It's
also a
been
direct
seen.
correlation, if I'm not mistaken, between skeletal muscle mass, like lean skeletal muscle mass, and diseases. I think like Alzheimer's, dementia, like there's a lot of degenerative diseases as you get older as a guy that you're more likely to get if you don't have. I mean, not bodybuilder size muscle, obviously, but like lean skeletal muscle on your body. Where, I mean, I tell guys, look, if you can't do 20 push-ups, 10 chin-ups, and skip rope for a minute or two, at least start there. Like that's a basic foundational sort of like requirement for most guys, and that should be the same if you're 30 or 50 or even 60. I mean, you should be able to do something basic like that at any age. So, what's the relevance to the amount of like skeletal muscle mass when it comes to minimizing, limiting aging, degenerative diseases and all that stuff?
So skeletal muscle is uh, one way of looking at it is it's a metabolic sink. So most of the energy that you use has to do with skeletal muscle,
Hmm.
and I mean, unless you were if you were completely sedentary, a lot of the energy just goes to maintaining your basal metabolic rate. But your skeletal muscle uses a lot of energy. It's a sink for glucose, and so it is very important in aging. And the fact that a man who gets to the age of 80 can have lost half the muscle mass he had when he was 20.
Right.
So that's a huge amount.
Hmm.
And so one consequence of this is that people become frail, and they become, if this goes, of course, we're generally talking here about quite elderly people, but if you get frail enough, then you need help living. If you can't get out of your chair by yourself, and this happens a lot,
Hmm.
and then people end up in nursing homes for this reason. But as far as your overall health, there's definitely a correlation with the amount of muscle you have. There's a correlation with mortality. So with people have more muscle mass, they have lower death rates. So all these things, and then regarding these changes that, like I was saying, that resemble diabetes or obesity, you can fend these off with having more muscle mass with doing strength training. So as far as anti-aging goes, I consider strength training to be fundamental. And the other part of this, of the training and with regards to aging, is keeping body fat off is very important too. So, there's older people generally have poorer metabolism. So this has actually been looked at. So for example, insulin sensitivity, which is really important. They look at these older people. Their insulin sensitivity is not as good as people who are younger. However, when they control for waist size, they find that there's little difference. The difference is that these older people put on body fat, put on visceral fat.
Mm.
And if you can keep that off, then your insulin sensitivity is going to be very nearly that of a younger person.
Speaking of
It's
insulin sensitivity, what's your take on metformin as an anti-aging compound? Do you take that? Is that something that you recommend?
I have taken it from time to time. It's one of those things that I can't say that I've noticed anything,
Hmm.
uh, uh, that it's done. The So this is interesting. So metformin is an anti-diabetic drug,
Hmm.
and so this fits in with what I was just saying. As people age, they have these manifestations of something that resembles changes towards diabetes, and this also so metformin, an anti-diabetic drug, fights aging. So it has been shown to extend lifespan in lab animals. Now the question is, in my mind, does metformin do anything for someone who is already lean and fit? Or is it merely combating what we, uh, are basically our modern food environment, our modern sedentary environment? What is it doing? My I've thought about this a lot, read about it a lot. My view is yes, it may do something for older people who are already lean and fit and doing everything. It obviously, like with so many things, it does more for people who need it more.
Mm.
So yeah, so there's going to be a clinical trial of metformin, to to uh, to look at its anti-aging effects in humans. Um, One thing about metformin is it's dirt cheap. You can pick it up for like 5 or 6 cents a tablet, and it's generic. So there's very little incentive for people to study it.
Mm.
In human beings, most of the work has been done in animals, but of course, a lot of people take metformin. It's the most prescribed anti-diabetic drug, so they've looked at a lot of these populations too.
What about other compounds? I was watching this conversation with Dr. David Sinclair, I think is his name. Do you know who he is?
Yes, I do. Uh-huh.
And Huberman, they were talking about anti-aging and longevity, and I think the two compounds that stood out were resveratrol. I don't know if I'm pronouncing that right. That,
Resveratrol.
yeah, that's it, and something else called NMN, which studied in lab animals apparently extended their lives like by something like 30%. Like lab mice like live 2 years max is pretty standard. They were seeing them live to like 4 or 5 years. Um, what do you know about that stuff?
Yeah, yeah. So this is interesting too, from the same point of view as metformin. So NMN is nicotinamide mononucleotide. There's another similar compound. They're not the same, but nicotinamide riboside. These are both forms of vitamin B3, nicotinamide or niacin. And so nicotinamide is not exactly the same as niacin, but they are both forms of vitamin B3. Um, so it's and they make a certain compound NAD plus that is important in metabolism that declines with age. So this is the basis. I tried taking NR, nicotinamide riboside. I tried taking it for a month, didn't notice anything, and it was quite expensive, so I stopped. There's also some evidence, and these people like David Sinclair or Charles Brenner is another one, might dispute me on this, but there's also some evidence that just taking plain old vitamin B3, nicotinamide, will do the same thing
Hmm.
as far as raising your levels of NAD plus. The other thing is that if you look at what happens when people go on a low carb diet or start exercising with intensity, is NAD plus levels also go up. So just like with metformin, what we're looking at here is this really doing is this going to help lean and healthy people who are already lean and healthy who are old, like NMN? Is it going to do that? I don't know. I have to be agnostic on it. I'm not taking it, and I feel like my diet and exercise is probably keeping my NAD plus levels just as high as they can possibly be. And if you take vitamin B3, nicotinamide, plain old, see, these supplements like NMN or NR, I don't want to attribute nefarious motives to people, but one reason that people are looking into these kind of things is because they can make money at it, right?
It's an
Okay, so
expensive supplement. Very
sure,
expensive supplement.
sure.
Yeah.
And so there's nothing wrong with making money. But if taking plain old vitamin B3, which is really, really cheap, it works the same. Obviously, they're not interested in looking at that.
Mm.
There's a very similar one, a recent article was published on this new supplement called Rejuvent. And Rejuvent, so they've tested it in animals and it extends lifespan. And they did this study on humans where they looked at markers, epigenetic markers of aging, and it made these markers go down. So they were epigenetically younger from taking Rejuvent. Well, what is Rejuvent? Rejuvent is a compound called alpha ketoglutarate and some vitamins. So alpha ketoglutarate, you can go on Amazon and buy a big bag like this from bulk supplements for, $20, right? So, but who's going to make money at that? So they have to put it into a proprietary formula, and so they can say it's got
Give
alpha
it a special name.
ketoglutarate and some vitamins, special vitamins, and yeah, give it a name, and then test it on humans, and then they can say, see, look, this study shows Rejuvent, and then sell it for 50, $100 a month, whatever. So this dynamic is going on a lot. Rapamycin is another one, a very promising anti-aging drug, and it's more expensive than Metformin or Rejuvent or NMN or anything like that. However, it's still generic. Nobody has an incentive, to really study it in humans. As far as resveratrol is interesting. I took it for a long time. I'm no longer taking it. Resveratrol has never been shown to extend lifespan in mammals, right? So it's extended lifespan in some lower or so-called lower organisms like worms and flies, but they give it to mice. It helps protect against the effects of a high-fat, high-sugar diet in mice. So
They actually said so.
good
Sorry,
for that.
just to correct that. I think he said that if you take it daily, it doesn't have much of an effect. But he said that if you take it every other day, then that's when they saw the longevity effects on the lab mice.
Well, I don't know about that. The one big study that came out maybe 15 years ago that or 10 years ago that seemed to result in a lot of people losing interest in resveratrol was that it did not extend lifespan of these mice, that it did protect against the high fat, high sugar diet. But so this is another thing similar, like I was just talking about with metformin or
Yeah.
NAD plus. Is like, what is this doing? Is this protecting against a horrible food environment, a horrible sedentary environment, or is it really fighting aging?
Mm.
Um, Disentangling these things is difficult because everybody's living in this environment, and pretty much, I mean, over 80% of the U.S. population is either overweight or obese, and it gets worse as
Is that what
people
the
get
number is now?
older.
It's like about 80% now.
It is, yes,
Wow.
and a lot of the rest of them are skinny fat. So
Same,
it's
same.
yeah. I mean, only one study showed that only 12% of the U.S. population was metabolically healthy.
That's horrible.
Yeah,
And they're cramming all these jabs down everybody's throats, and you don't do these, you don't get to go anywhere. But they never say anything about losing body fat or eating properly.
that's right. That's right. This is something that I've talked about quite a bit over the last year and a half. I mean, obesity, diabetes, those two, along with pure chronological age are the biggest risk factors for having severe COVID disease, and also vitamin D deficiency.
Yeah.
I mean, vitamin D, um, again, it's dirt cheap,
It's
just
free.
like some of these things we were talking about, and nobody's mentioning it.
I got to ask you though, like, to be specific, because I mean, you look good for your age. I mean, it says on your Twitter you're 66, and your skin doesn't look 66. I mean, people might even argue watching this, like, I'm in my late 40s, that we look the same practically as far as the skin condition. Like, what do you take as far as supplements for anti-aging for yourself? Is there anything that you rely on at this point, or is it just lots of water, good diet, and exercise and sunlight?
I do take some supplements. As far as my skin, I guess, uh, genetics again probably has something to do with it. My mother had nice skin into a very old age. Um, but I do take some supplements. I do credit diet and exercise with a lot of what I look like and how I feel is certainly the most important thing. Uh, people, and I'll tell you about the supplements, but people want to, there's this idea of adding something versus subtracting something. So, people want a magic pill, something to take that's going to, um, you know, um, negate their bad habits or, anything else they're doing,
Hmm.
rather than, subtracting what they're doing that isn't helping them. So, I mean, this phenomenon is not just in the world of supplements or something like that. I mean, every doctor deals with it, right? So, somebody goes to the doctor and the doctor says, "Well, you've got diabetes," and the patient says, "Okay, doc, give me a pill," rather than change the conditions that led them into diabetes.
Right.
So this is just everywhere. That's what people are like. So anyway, yes, diet and exercise. I take baby aspirin, and I have been for quite a while. So there's some good evidence for that. If you talk about it online, there's all kinds of controversy, but I've decided that it's good for me. Um, and also, by the way, with baby aspirin, let me just add, there can be serious side effects. So I don't tell people, yeah, go ahead, take aspirin. It's something that basically should be talked over with a doctor and decide whether that's a good thing to do. Um, I take magnesium. So magnesium is really important, and this is a supplement that probably most everybody could use.
Is there a
Um,
version that you like? Thionate, chelate,
I take magnesium citrate.
citrate? Okay.
There are some other good ones, like glycinate is a good one. It
I think
it
theonate's the one that bridges the blood-brain barrier. Like, that's better for your brain, especially for sleep too.
I believe that is correct. Yes.
Okay.
Um, so vast numbers of people in the United States are magnesium deficient.
Oh yeah.
Um, and this has to do with a lot of things like, for example, monocrop agriculture has leached magnesium out of the soil, and so they're not getting as much in their diets. People used to get a lot of magnesium from drinking hard water, which they don't anymore, and then other things like caffeine and alcohol can deplete magnesium. So there's all kinds of reasons. So I do take magnesium, and I feel that most people would benefit from it. What else? I take vitamin D. So this is something I've been doing a long time. I take 5,000 IU's of vitamin D every day, except maybe in the summer when I'm getting some sun.
Hmm.
Um,
Do you use
so
sunscreen when you're outside in the sun, or no?
no, no, I don't. I don't use sunscreen. Most of the sunscreens out there are basically toxic brews.
Yeah,
And there are some that are better. You can find them, but the
like the
average.
zinc-based ones.
Yes, exactly,
Yeah.
exactly. And oddly enough, what is her name? Gwyneth Paltrow, I think, has some sunscreens that are like pretty good,
Hmm.
if I'm remembering correctly. But you got to seek those out. If you just get regular sunscreen, it's no, you don't want to do that. Best sunscreen is shade,
Suntan
clothing, and a hat.
or suntan.
Yeah, yeah, or suntan. But I mean, people say, well, people ask me, well, I'm going to be out in the sun all day long. What do I do? I say, well, put on a long sleeve
Long
shirt and
sleeve,
wear
yeah.
a hat.
Yeah.
Um, so yeah, so vitamin D. I take taurine, which is an amino acid, which has some good anti-aging effects. Um, I over the last
What are the
couple of years.
anti-aging effects of taurine? Because I understood it just to be a cell volumizer or like an energy source.
Um, it functions as an antioxidant in much the same way as glutathione does, or
Oh,
in
is that right?
somewhat the same way.
Mm-hmm.
Yes, and so um, our cells have the ability to make taurine, and we get some in our diet, but it does deplete with age. So that's something that I've found useful for me. Here's another one, citrulline. This is a really interesting supplement. Um, Citrulline promotes the production of nitric oxide in blood vessels. So
Mm-hmm.
this is very important. Nitric oxide allows blood vessels to expand, to dilate, and so this is a really important thing. There's good evidence that all of this, the dilation and so on, or lack of it, is involved in coronary artery disease and so on. So citrulline helps promote nitric oxide production. So that's a good one. And
It's good for gym pumps. It's also good for bedroom pumps too.
yep,
Blood vessels all over your body. Yeah.
exactly. That's what it does. Yeah, you can find citrulline added to
You can just get
pre-workout
a
supplements and
big
so
bulk
on.
supplement bag off
Ex-
Amazon. That's the one that I've bought in the past.
exactly.
Yeah.
Right. Right. So that about covers it.
Okay, that's interesting.